Today we are going to assess person-centered therapy for childhood physical sexual abuse, and we're going to analyze the strengths and the weaknesses of that therapy. And first we're going to go over the learning outcome. We're going to assess the value or importance of the therapeutic intervention used in person-centered therapy for childhood physical and sexual abuse. We're going to evaluate the efficacy and inefficacy of person-centered therapy for childhood physical and sexual abuse, giving reasons for the evaluation. We're also going to examine the appropriateness of the conclusion reached based on the data presented. We are going to demonstrate the ability to evaluate, integrate, and apply appropriate information from various sources to create cohesive and persuasive argument. And we're also going to apply previously learned information about therapeutic intervention used in person-centered therapy for childhood physical and sexual abuse to reach an answer. Person-centered therapy. What comes to mind?
Self.
Yourself. Anything else?
Mental health.
Hmm?
And mental health.
Mental health. Okay. Okay. You know, therapists use person-centered therapy intervention. So what comes to mind when you hear that?
Therapy targeted toward the person versus like medication or something like that.
Yeah, it is targeted toward the person. Anything else? You hear the name, like just the name. You don't know anything about it. You just say, okay, this therapy intervention is a person-centered therapy. Okay, but we're gonna learn about it. Person-centered therapy was founded by Carl Rogers, and it was founded in 1940s throughout 1950s, and basically it has, as a therapist, you have to show unconditional positive regard. You have to be genuine. You have to be empathetic. You cannot judge the client at all. Like no judgment towards the client. These are some of the techniques that you can use in a person-centered therapy. You have to be non-directive. You have to accept negative emotions. You have to use active listening. You have to be, like I said, empathetic. You have to show unconditional positive regard, and then you have to show reflection. In your body language, you have to be mindful of your body language when you're using it with a person. In person-centered therapy, it is recommended that you call the person a client instead of a patient. So if you call it a client, it shows that the person is like someone who is part of the process instead of okay, just a patient. And that when you hear the word patient, you see medication, you see hospital, right? So it also is recommended that you view the person as a partner instead of a helpless patient, like someone who has no control over the process, but it's a partner, so he has a say in what is going on in the process. And these are the goals for person-centered therapy. It facilitates personal growth and development. It eliminates and mitigates feelings of distress. It also increases self-esteem and openness to experience, and it also enhances the client's understanding of him or herself. And so we're gonna go over the strength of that therapy, person-centered therapy. These are the strengths. Like genuine deep respect for the client, so you respect the clients, you know that the person has a say in her process, he or she knows what he or she has been going through, so you respect and you have a deep respect for that client. The relationship is key, so that's why it says you don't see the person as a helpless patient, but you see it as a partner. So you have with a partner you have a relationship. And like I said in the beginning, you show unconditional positive regard as a therapist. And person-centered therapy, since it has been founded by Carl Rogers, it has been contributed to research on therapy on various other therapy that they've been using over the years. And this quote is from the founder of that therapy, person-centered therapy. It says, "Mind who knows what hurts, what directions to go, what problems are crucial, what experiences have been deeply buried, it began to occur to me that unless I had a need to demonstrate my own cleverness in learning, I would do better to rely upon the client for the direction of movement in the process." So this quote clearly summarized the whole process of that therapy. And now we're gonna go over the weaknesses of the person. Remember, one of our learning goal is to evaluate the strength and the weaknesses of it. Therapy focuses on the person. It views the person as the one who knows what he or she has been going through, and it elevates the person to a point that, okay, you want the person to see her worth, to see herself as a whole person and not just a helpless being. So one of the weaknesses of it is that it can lead to inflated view of self, like the person is like view herself as a god, or like, okay, I know everything. It can also like not only that, it only focus on one, like on the person, just the human being. It neglect other factors such as social, cultural, political, economical, and biological. Like he doesn't view any of these other factors, just the person. And that can be a problem across culture. Like if you see in Asia, people value family. They don't just view themselves, but they value family. So this kind of therapy can be a problem when you're using it with an Asian person. And person-centered therapy views the process as one size fit all. Like if you come and you have this problem, so we're gonna use the same technique with you. And this other person comes in with another problem, they're gonna use the same technique is used for everybody. So we know clearly that one size does not fit all when it comes to therapy. Like you gotta analyze the person, you gotta know what works for that person. What works for that person may not work for that person, so you gotta be mindful of that. And the therapist may lose sense of his or her own self. Like in the technique, the therapist will value the client so much that the therapist might lose their own or his own self. Okay, in study, we see that about 28 to 33% of women and 12 to 18% of men have been sexually or physically abused throughout in this country. Okay, now we're gonna see the impact of sexual and physical abuse. The impact of it is that it produces anxiety disorder, it impaired impulse control, cognitive, and it impairs also cognitive and language. It gives you cognitive and language impairment, and it attacks the central nervous system. It causes to dysfunction, and it also hinders normal social growth. Like someone who has been physically and sexually abused might be someone who stays to himself or to herself, doesn't really socialize with other people. There are some other impact of sexual and physical abuse, like the common one among like everybody that have been interviewed, everybody that they have been talked to, the common one is depression. Like someone who has been through physical and sexual abuse, they usually depressed, and they feel guilt, shame, they blame themselves. They have eating disorder, they have sexual problems, and they also have relationship problems. A lot of times when you talk to someone who has been physically or sexually abused, they have difficulty maintaining relationship with other people. They have problems trusting other people, and that can have an impact on their relationship. The victims of a sexual or physical abuse, they tend to think negatively about themselves. They they usually, it's not like, okay, if you've never been sexually or physically abused, you might, like, if you're talking to someone who has been sexually or physically abused, they might, you might think that, okay, you should blame the person who has sexually abused you. But in contrast, the person who has been sexually and physically abused, they usually blame themselves instead of the other person. They have a feelings of worthlessness, and they avoid others, like they don't socialize at all because they think that they have nothing to offer, because they think of themselves like, oh, I'm worthless. And they usually have suicidal ideation, and they have problem with their sleeping and eating patterns. Okay, when you encounter or when you come in contact with someone who has been physically and sexually abused, these are some of the techniques that you can use to build a relationship with them. You have to use encouragement. You have to validate the person. You have to use self-disclosure and show the person that you accept him or her for who he or she is. You have to build trust, safety, and openness. You have to have control. You have to let the person know that he or she has control over the pace and the direction of the therapeutic process. So these are all the things that you need to know about physical and sexual abuse on childhood. So now I want you to pair up, and you're gonna think about it. You gotta talk to your partner, and then we're gonna share it with the whole class. Okay. After knowing all of these, should person-centered therapy still be used for childhood physical and sexual abuse? After knowing, okay, this is how the person is, after knowing the strength of the person-centered therapy, the weaknesses of that therapeutic process, so should it still be used for childhood physical and sexual abuse? Now think about it. You gotta talk to your partner, and then we're gonna share it with the whole class. Okay. After knowing all of these, should person-centered therapy still be used for childhood physical and sexual abuse? After knowing, okay, this is how the person is, after knowing the strength of the person-centered therapy, the weaknesses of that therapeutic process, so should it still be used for childhood physical and sexual abuse? Now think about it, share with your partner, and then pair up, and then we're gonna share with the whole class. All right? You two can be together, you three can be together. And you gotta give reasons for that too, not just yes, it should be used.
One person
Why?
give reasons, or everybody?
I would choose.
You'll choose.
Yes.
Oh.
What's the reason?
You said yes.
So, you know, why we have to
Yeah, I would say yes
why we have
because,
to just
you know, because the person went through the situation.
for child.
So you would have them open up so they can talk about the situation. And then you more likely, you know, you are a listening ear. You just listen to them and let them express themselves. You know.
But isn't it a one-stop shop, like the same process for everybody?
True, true. But you know, you would still use your experience to guide them at the end. But I would say at first you just listen to them.
Can be beneficial.
And if they don't want to open up, then you have them open up. You see what
But
I'm
at the
saying?
same time, so that how it will benefit the child.
Alrighty.
With the film.
Since you guys don't want me to choose, who wants to share with the whole class? Why or why not person-centered therapy cannot be used or can be used for childhood physical and sexual abuse? Should
one
she will
person
not.
in each group?
Anyone who wants to share can raise their hand and you can just share.
I never raised my hand.
So I can say it can be used,
Mm-hmm.
but at the same time I was wondering how can they benefit from it? Because you might use this therapy to help, but how those child gonna be ready for help? So it doesn't matter how long you're gonna try all the procedures you're gonna follow to do it, but if they're not ready for it, so how are they gonna benefit from it? I think if they ask for help, I think it's time we can use it, but at the same time, if there's other options that can really help them, mentally, physically, they can use them as well. But I'm just wondering how they can benefit from this therapy.
So I'm getting that it can still be used, but you can use other technique like other therapeutic things with it
So
for it to be effective.
beside that, I was wondering how they're gonna be benefit from it from using this technique, because from what you said that all the techniques and then different aspects of it, but I would like to know how using this technique can be beneficial for the child.
Well, and when you were having a session with with a client, you would know, okay, it's just the two of you, like either the person is a victim or someone who has sexually abused. You can have both, not at the same time. You can have someone who has been abused. You can have someone who has abused people. But if you're having someone who has been abused, the way you do it is you let the person express himself or express herself, and then you reflect on what he or she is saying. Okay, the person might say, I was sexually abused, this and this, back, okay, in March something, and I haven't been feeling myself lately. I've been feeling like I haven't been able to sleep well and stuff like that. You will listen to the person. You build that trust first. You listen to the person, and then from what the person is saying, you put your thought in what the person is saying. It's like, okay, so you might ask a question like, so why do you think you will need to, okay, like the person is like, okay, I have problems socializing with my friends. I haven't been able to go out with my friends. Like you might ask the person, why do you think it'll be better for you to go out with your friend instead of staying at home? Like internalize the what has happened to you. Do you get what I'm saying?
Yeah, I
So
get you.
so that's one thing that you can do, but the this thing, like it says, like it's one size fit all with like you use the same technique with everybody, but we know that not everybody has the same symptom, not everybody views things the same way. So this was one of the weaknesses of it.
I mean, like, I was wondering if this technique is kind of treatment for people who abuse, being abused, or the thing is, I like to know the process. If I'm doing this thing, what gonna be the result? Why I have to use it? I mean, you ask the questions. I wanna know exactly after using this technique, is it gonna help the person like treating with those like thing like abusing stuff, sexual abuse. I wonder is that like a treatment for it or just like something to know the person. Sometimes you can use a technique just to know the person, come up with other things
Yeah.
to treat or
But study have shown that therapists they usually use person-centered therapy with other form of therapy technique. Like they don't use it by itself. That's what studies have shown.
Okay.
Use it by themselves. They use like they use a little bit of that, a little bit of that, and that's why you get to know your client first. You build that relationship, you build that trust with the client, and then that's when you best serve the person.
Now, I was just gonna say that I think this technique, you start with it first to know the client, and then from the answers that you're getting from your clients, you will figure out another technique that you can use, and it will probably be more sufficient
Effective.
or effective, like you said, for the client. But I think this technique is the first one to start with, so that you know your clients, you know what's happening, what's going on, why they're feeling this way, why they're acting like that. And after you do that, you can figure out, since you said they do a little bit of this, a little bit of that, so after that, they will probably do another technique that they see will benefit the client.
Yes, I agree.
Yeah, I think I was gonna say the same thing. So I second that thought. Yeah, so I think that's a great technique to start with. You get the client to open up and like talk about themselves and express themselves freely, and make sure that it's like a non-judgmental environment. And then once you see what kind of client you're dealing with, then you can choose whatever technique you want
With
to
this.
proceed with. And then one thing I was gonna say about that technique, I think is very good, because you let the client themselves tell you their own story instead of coming with your own story.
Yeah, that's one of the things that therapists like about it. It's like, yeah, you don't project your own thought
Yeah.
into the person. You just let the person be.
Mhm.
Yeah. Anyone else? Mm-mm. So, do you think it should still be used for childhood physical and sexual abuse?
I do.
Any reason why in particular?
What they say.
Yeah, that's what we discussed.
Do you think it should still be used?
They're in the same group.
Yeah, like
I'm getting
that's
them
the
out.
group right there.
So, should it still be used?
I mean, yes, because he allows you to establish relationship with the client. But the thing is, it cannot be used by itself, because, like you said earlier, and that was my concern actually, because it feels like it's a one-stop shop.
Yeah.
Like I mean, my problem is not your problem,
Mhm.
and yours is not my problem. What I went through is not what you went through. Even if it's the same thing, the
Yeah,
way
you have
that
different
we
will
took
process.
it, like,
Mm-hmm.
I mean, it is different.
It
So
might be
it
different
cannot be
styles,
used
yeah.
by itself. I believe it should be used with different techniques.
Yeah.
So
Yeah, that's what they do. That's what therapists do. They don't usually use it by itself, and that's why it has been used for in research too. When they do research, they figure out that it has like one size fit all cannot work for everybody. Like no. So now I would like for you to take out your phone. We're gonna go on Kahoot. Now we're gonna make sure that you were following along. The pin is 185892.
What was that?
185892.
How do I get to the?
You just like
1858, 92.
Mm-hmm.
you have
1858, 92.
Oh, I see.
Yeah. Okay, Jesse is on. D-Ben. Dern Sally.
1858, 92.
once you're done.
I'm missing two more people.
Mine is loading.
What's your name? You have to put a nickname.
Masterpiece, yes.
Whatever.
Still loading? You wanna use
I-
it?
I think I'm ready. Yeah.
Yeah. We're good. Alrighty. Questions. Assessment of the person therapy. And why here was person-centered therapy founded? Go ahead. We have 1900 to 1910, 1840 to 1850. We have 1940 to 1950 and 1800 to 1810. One answer, two answers, three answers, four answers, and who's
Okay, I got it.
who's first?
I got it.
The right answer is 1940 and 1950. We have two people who has it right. It was 1940, 1950.
40, 1950.
All right, next question. Ooh, Joe is zero.
I'm 0.
Just because 0. Okay, next question. Who founded person-centered therapy? We have Carl Wynn, Carl Rogers, Jack Rogers, and no one. 2 answers, 3 answers, 4 answers, 5 answers. Everybody got it right. Carl Rogers. All right, Joey's next question. What is one of the techniques for person-centered therapy? Empathy. The first one is empathy. Be directive. Be rude. None of the above. Two people got it wrong.
Not me.
Who took none of the above? You have
Somebody
to.
did.
Two people took none of the above. You have to be empathetic.
It's okay, teacher.
You have to be empathetic towards the client. You cannot be rude. You cannot be directive. That's why they say you let the person talk. You let the person tell his or her own story. So you have to be empathetic, people. Be empathetic. Darn Sally first. What? Why you? Who? Jessica's last.
I'm last.
Yes, you
I'm
are.
not last.
Which one has 3 of the factors that are neglected in person-centered therapy? We have social, psychological, and needs. We have wants, pets, and food. We have cultural, social, and school. We have social, cultural, and biological.
Can you repeat the question?
So which one has 3 of the factors that are neglected? Remember, I said multiple factors. Social, cultural, and biological. Nobody?
So nobody answered.
Social, cultural, and biological. Remember, it only views the person, so it neglected
Sorry,
all
I
of
didn't
them.
know that was time.
It neglected social, cultural, and biological, economic. So, all right, we still have Barry Soleil in the first place. Next question. I believe it's a true, false. It is recommended to refer to the person as client instead of patient. True or false?
Everybody better get that.
True. Definitely, it is recommended to refer to it as a client instead of a patient. Alrighty, we have people moving up. True or false? Next one. It is encouraged to judge the client in person-centered therapy. It is recommended to judge. Good. It is recommended to not judge the person. That's why you let the person talk. You don't judge the person. It's a non-judgmental one.
Who's Pete?
Peter. One of the strengths of person-centered therapy is unconditional positive reward. True or false?
Say the phrase again.
One of the strengths of person-centered therapy is unconditional positive reward. All right, it is true. It was in the very first slide. It is you show unconditional positive rewards towards the client.
Okay.
Okay, we happy. We're moving on. Okay, next one. Relationship is not key in person-centered therapy. True or false? Relationship is not key in person-centered therapy. One more person. We're missing one person. False. We have one person says true. We know that relationship is key. You build relationship with your client. Okay, that's how you get the person to open up to you. That's how you build that trust with the client. Your relationship is key, people. So that's false. Okay, Justice moving up. Woohoo! All right, next one. True or false? Person-centered therapy can lead to inflated view of self. True or false? Person-centered therapy can lead to inflated view of self. True, it is true, people. The one person who said false is true. Like you elevate the person too much that the person can lead to inflated view of yourself. Like you view yourself. Remember, like I said, you view yourself as a god, or whatever. Someone who like, okay, I'm too much. Next one, true or false? Again. Alrighty, true or false? The person should be viewed as a helpless patient and not a partner in the process. True or false? False, yes. The person should be viewed as a partner. Like I said, the person should be viewed as a partner and not a helpless person. Who won? Pete.
Number 3.
Number 2, the band, or the band. Number 3, Dirt Sally. Good job, guys. Alrighty. We know person-centered therapy was developed by Carl Rogers in 1940s, 1950s, and it has its strength and its weaknesses, and we've said it, and research has shown that it is not good to only use person-centered therapy and like only that, because it only use like one size fit all. So it is best that you use it with other techniques to best once you use it, you build that trust, you build that relationship with your client, and then you can use other technique to best serve that client. Any question?
What if the client doesn't open up?
Well, I've seen it in videos. I've seen it in even in movies, like where if you cannot get through the person, you have to refer the person to another therapist. You have to be able to build that, like you have to be able to build that trust. If the person cannot trust you, cannot really trust you to open up to you, you have to refer the person to another therapist. Like if the person doesn't trust you, nothing you do will be able to help the person. You will not be able to help the person. So yeah, any other question?
What other techniques, if you remember any of them, that you can use for these patients?
I don't quite remember
It's okay.
some of them. All of them. No, I don't quite remember. But there are a lot. Oh, I remember one of them was Aldarian, something like that. Yeah. And even with the person-centered therapy in 1950s, they kind of changed the name to client-centered therapy. So,
Okay.
yeah. Any other question?